Hi, I'm Belleruth Napperstack, and I'm a clinical social worker and the founder of Health Journeys, which is a company that produces guided imagery, meditation, hypnosis, relaxation, mindfulness, yoga recordings. And often we apply them to specific conditions. So sometimes we just have stuff for stress and sleep and pain, the usual stuff. But we also have very specific guided imagery and meditation for cancer and stroke and depression and post-traumatic stress, and to help with chemotherapy or dialysis. So we have lots of stuff. It's very condition specific. And because of that, we get a bunch of questions from people, often asking about the interaction of the particular technique with the particular condition. So we get some pretty great questions. That's why we started this video business. We thought we'd make it a public health effort and tell people what we know, or what we think we know. We hope we know. So here's a question that I got from the UK from a woman who I'm going to call Andrea, and she has lupus, which is an autoimmune condition. So she writes, I've been using your lupus healing meditation for very many years and have found it helpful. I also used your guided imagery for preparing for surgery a couple years ago. At the moment, I seem to be going through a post-viral kind of reaction after a possible COVID infection back in March. She says, I'm assuming it's a lupus flare-up, but it's worse than any other I've ever had. Oh, and this time my husband is ill too. She really won the lottery on this situation. She asks, here's the question. She asks, would you recommend the new guided imagery for resisting viral infection to use now, or is there another guided imagery that would be more suitable, considering the fact that I have autoimmune disease? So this is a great question. It gives me a chance to preach a little bit about the importance of doing certain things with guided imagery, because it does work and you want to use it right. So I responded by saying, hello, Andrea. Dr. Emmett Miller's imagery for resisting viral infection, I think we released that maybe 3 months ago, 4 months ago, something like that, is ideal for anyone looking to amp up their immune system, the better to fight off acquiring an infection and to maintain a robust, protective, and vigilant army of white cells against any outside invaders seeking to do harm. So, that would be someone aiming to deny the coronavirus a free pass into the body, and instead to cheerlead their own white cells to block, tackle, and destroy before the virus can get a foothold. And there are studies, by the way, of guided imagery with other viruses, not this one yet, but with other viruses such as herpes simplex and various colds and flus. And those do show that, in fact, there are heightened bursts of immune activity lasting for 30 to 60 minutes post a guided imagery session. It can be very brief. So that would be something for somebody who's healthy, worried about somehow catching the coronavirus and wanting to keep that from happening, even if they inhaled some stuff, but they wanted their body to fight it off before it even registered on their immune system. But for someone with lupus, as she knows a lot because she asked the question, for somebody with lupus, an autoimmune disease, which is defined by an overactive immune system that tends to attack the body's own tissue. So for this kind of situation, that audio for resisting viral infection could be a risky proposition. because those immune cells do not need extra encouragement. And it would also be a bad bet for someone who is already infected with COVID, or who once had it and might be having a reprise later on. And that is because, as we have learned with COVID-19, the immune cells can sometimes go into overdrive, attacking lung tissue and other organs, and even the linings of the blood vessels, causing even greater damage than the original viral infection could do, through inflammation that just won't quit. So, Andrea, you have two strong reasons not to use that immune-enhancing guided imagery. So that's the bad news. But there's good news, and that's why this question is so timely. So that audio is not going to be right for you. Don't go near it. But the good news is that Emmett has just completed some guided imagery for people who have COVID-19. And the focus of that imagery, knowing what we know, is on keeping up the protective function of the immune system, but in a modulated, balanced way, bringing in the suppressor cells to pull in the reins when some slowdown is called for. So the imagery is like perfect for this kind of hyperinflammation that can happen with COVID. So Emmett got state-of-the-art input from our go-to virology and immunology experts, and this imagery really is perfect for your lupus, Andrea, and any possible post-COVID complication. And not surprisingly, Emmett calls this one overcoming viral infection. The other one, the earlier one, is resisting it. But if you didn't resist it and you got it, then you do want this one, overcoming viral infection. I'm very proud of this because he did a great job. Anyway, so this brand new imagery has already been available, I think, for 3 or 4 weeks to our app users. It's because subscribers get several weeks of advance access as a special perk of being a subscriber. But the time for that to be released to the general public, this title, is pretty much here. I think it is here, or it's about to be here. By the time you see this, it will have been here, and that's enough verb forms to hold you for a while. But I'm delighted to unequivocally recommend this imagery without reservation for anyone who wants a well-functioning immune system that doesn't run amok, because the imagery will support that. So all best wishes to you, Andrea. And if you feel like it and you got the time, please check back in if you feel like sharing your experience with this brand spanking new audio by Emmett Miller. Thanks. Take care. Be well. Get well fast. And I hope your husband does too.